The GeparSepto study was investigating if the exchange of nab-paclitaxel by nab-paclitaxel followed in both arms by EC would lead to an increased PCR rate. This could be demonstrated overall, but we were of course curious how would that play out in the subgroups of luminal patients, triple negative breast cancer patients, and those HER2 positive with or without hormone receptor expression. So the patients with HER2 positive disease received, in addition to the chemotherapy, pertuzumab plus trastuzumab from the very beginning, though the whole 24-week long chemotherapy, and continued after surgery with trastuzumab for up to 1 year. So that was the design basically. And we have seen, which is not surprising, that in the HER2 positive cohort the PCR rate was much higher, and we achieved a PCR rate of 75% almost in the hormone receptor negative HER2 positive cohort, and there was a difference in favor of nab-paclitaxel, but it was not statistically significant. So in that group the HER2 treatment is probably more important than the chemotherapy schedule. What we also found, and this is has already been seen in previous studies, that the definition of the pathological complete response is more important in the HER2 positive cohort than in the triple negative cohort. In the HER2 positive cohort, the in situ residuals, the group is much larger, so increasing the PCR rate from the very strict definition with YPT0, YPN0 by 10-15%. If we use the more flexible definition and including non-invasive residuals into the definition.